Kenya Switzerland Development Authority KESWIDA was formed in the year 2005 with open and like-minded friends who sat together to discuss HIV pandemic in Kombura community. KESWIDA members started an initiative of guidance and counseling to reduce stigmatization in infected and affected community members. They also did advocacy in behavior change among the youth and women.
Came into partnership with KESWIDA in 2011, March. Up to this time, we are partners with KESWIDA.
When KESWIDA agents within the area thought it wise to come to Bonde to contact us for accommodation.
What we are doing, we are partnering up with the school administration just to motivate the health of the community at large.
Through funding from Director Alfred Modi, like-minded friends, KESWIDA has been organizing treatment camps to eradicate some diseases and to create more awareness on HIV and AIDS. KESWIDA has partnered with Bonde Kakoko Primary School for good reasons.
Now, what brought about the partnership was on the community health programs. So KESWIDA wanted a place to hold its programs concerning the health in the community. So he called upon us and we came to an agreement after studying the facility we had in the school.
As yet, no, they don't pay anything.
This school we have not paid anything.
There has been an effect on this because the pupils now are being treated free of charge, and also KESWIDA has also gone into the should I say the performance of the school with the pupils. There are some programs which KESWIDA are now taking upon concerning the pupils, which also promotes their performance.
We are partnering up with this school just to improve the academic standard of this school by introducing some e-learning facility in the school, and also to introduce lunch program for standard A's.
KESWIDA saw it wise if they could bring this treatment facility or program into the area. So dealing with the community directly and also the children who are the beneficiaries of the program.
The community has a lot of challenges.
The school is situated in an area which is flood-prone area, and this area sometimes brings about diseases when it's flooding, like malaria, typhoid, bilharzia, and other diseases.
We don't have all the facilities we need. The school has developed a bit. This population is big. We are in interior. During the floods, our children were in water, going back for lunch, coming back for the afternoon lessons.
There are so many people coming, but we lack some medical equipments.
When they go back home, they have nothing to eat. Some of them don't have uniforms. Some of them even miss other basic things which the children want.
But the major problem we are facing, that's why we can't manage it on time, is finance.
We have many orphans due to HIV and AIDS, so some children are left to be taken care of by very old grandparents.
The main key contributing factors towards the malaria in this region is this place is waterlogged, and another thing, as you can see, it's so bushy, so the water around are very good breeding points.
The government has played a role.
I can say the government has taken care of that by providing mosquito nets, which were provided some few weeks ago.
We actually don't understand, because the government is distributing the nets free of charge. But the other fact is, we don't know whether they are using them, because you can give out the nets, but somebody does not use them.
The solution?
So we are seeing a situation where if we were able to provide some feeding program for the children, it would be much better.
As much as the government has tried so much to give them free water card to treat water, we are also having some other cases of typhoid and bilharzia due to the fact that the kind of water these people consume is not adequately treated.
So the government has taken care of the free education part by providing books, but the rest of it has been taken care of by the government. So the KESWIDA is now coming in to assist.
The treatment camp has been divided into several sectors. The camp is organized in such a way that clients don't waste a lot of time in queues. Kombura community members also appreciate this health initiative.
The day-to-day, you can see so many people are on the compound for treatment, which if it were not for that partnership and KESWIDA being the person doing it, we would not be able to treat these people.
The clients are many.
Today, the response, the turnout is very good because we have now received over 200 people.
Today, so far, we've seen the number of clients we've seen is 200 clients, but still there are quite a number outside which we are still struggling to clear with.
Today, we've seen a lot of them, over 200.
KESWIDA, in partnership with the school, has ensured the school as a nutritionist who ensures a nutrition advice to infected clients, pupils and adults within the community.
We counsel them, we put them on nutrition and show them how to feed as they take the drugs.
KESWIDA members started an initiative of guidance and counseling to reduce stigmatization in infected and affected community members. They also did advocacy in behavior change among the youth and women.
Counseling first before test.
We talk to them, then we guide them to the KESWIDA youth group who will counsel and test them.
I've come to know my HIV status. It's good to know your HIV status so that you can go and tell those people outside there that they come and have a HIV status.
I come to test myself in this tent to know where I am.
I've come to test myself so that I can know myself, and I'm now be careful so that I cannot affect others.
We normally tell them to maybe change their behaviors, maybe by abstaining, using condom, being faithful to partners of which they know the HIV status.
No, I don't have a girlfriend.
No, I don't have.
Sometimes most of them, they deny their status, so it's a bit challenging maybe to let them accept their status.
Stigmatization is still rife in this area. The community do not find it welcoming when you welcome them to come to VCT or voluntary male circumcision, but instead prefer to be invited to come and test malaria.
Our people are not strong enough in their character to come very openly for those ones. So since KESWIDA, all the day today, they are treating every disease, they should include that in the announcement. They are talking of VCT, the male circumcision, and others like that.
En adier ni jogweng' ni ko luong ni biopi mepimi gitero ji nyange to ogibi katuche mamoko to gibiro.
People has been running away if they had something like VCT.
KESWIDA staff had their way of analyzing the client satisfactions.
We do mobilize through Chiefs Barasa, and yes, formally since we started this program, we have seen some changes.
The ratio to maybe the infected to the unaffected is lowered. And also we encourage them to go for male circumcision.
Yes, our fifth plan as KESWIDA Youth Group, we want to move from CBO to NGO. We have our friend which is based in Switzerland, which is our director, which has been working tirelessly to make the KESWIDA CBO to become an NGO.
We are happy to collaborate with KESWIDA Group.
Get